It's my honor to introduce Dr. Lauren Fishman and his colleague Liz Larson. Just a quick introduction of Dr. Lauren Fishman. I am honored to call him a friend for the past 10 plus years. So he, in over 2 decades of his practice, he has gained an international reputation as a back pain specialist, a diagnostician, and a pioneer in the treatment of many disorders, including piriformis syndrome, scoliosis, osteoporosis, and rotator cuff syndrome. He has authored more than 90 academic journal articles and 10 books. His most recent book is Healing Yoga, Proven Postures to Treat 20 Common Ailments. Again, his accolades go quite, a long way, but a quick introduction on the yoga front. He studied yoga in India with BK Iyengar-ji, and he uses it in his rehabilitation practice and has written extensively about yoga as an adjunct to medical treatment. Today's session is about yoga therapy gets a grade, and the grade is A+. So he'll be reviewing the currently demonstrated effective yoga therapy for scoliosis, osteoporosis, and rotator cuff syndrome. For scoliosis, he'll review the successful work with adults and children with adolescent idiopathic scoliosis, and also the integrative medical techniques and yoga together. So again, it's exciting that we have a very renowned orthopedic and yogi with us, along with his colleague Liz Larson. So without further ado, Dr. Fishman, the floor is yours, and thank you for making time. So appreciate it.
Oh, it's my pleasure. I'm delighted to be here. I'm going to talk to you. I'm going to talk to you about the things I've done, such as they are, and the small achievements in the field that I hope others will improve upon. I'm kind of laying down the gauntlet. Okay, this is the best that I've been able to do. Now you do better. And I'm just going to introduce what's wrong, the illness, the medical condition, and then what yoga is doing. What you do, what poses you use, and so on. And then I'm going to talk about its value. Now, how it works is something we don't have time to talk about, but in the chat, you can ask all the questions you want to ask. And after there's a little more housekeeping when the whole thing is over, I'm willing to stay around to answer any questions that there are. There'll be a short Q&A, but some of the questions I think will be longer than the period, but we'll see. Anyway, it's time to begin. I'm just going to go into it right now. So let's take a look. Let's see what it is.
Do you want to quickly introduce Liz, Lorraine?
Oh, yeah. Well, let's see her picture. I thought she should come up. Liz is my colleague. Liz has worked with me. Let's see. I'm going to click on you, Liz. I'm going to make you, I can pin you, but they'll have to make you the big if they want to do it. I think they do. There you are. Liz has worked with me for 10 years, and you don't see any medals on her chest, but she deserves one for working with me that long and tolerating me in my rather idiosyncratic behavior. She's an MS and an MA, and she has she's been in charity work a long time. And she is a wonder. Well, you'll see, she speaks for herself, and her yoga speaks for itself. What else shall I say about you, Liz? What else can I say? She's been a great joy to work with in all the different ways that we have worked together. That is really true. So I'm going to go on into the program, though, because I think Liz is at her best when, well, she's at her best, which she's about to be. So I think I can do that. I call this is what I call it, yoga and medicine go together really quite well. Now, 10, 20 years ago, the yoga was the Department of Extraordinary Claims. And they would make things about the body, claims such as this posture banishes death, and the others that you see before you. And in the last 20 years, we've seen a great migration from yoga as something that is subject to authority. Not that the ancient books don't contain knowledge, personal knowledge that is extraordinary and invaluable. But as it makes inroads into empirical fields such as medicine, I've noticed a fabulous movement of people from trusting the authority of the ancient texts or their guru towards the evidence-based sciences that we know and love and really conduct our lives by. So I'm going to give you 3 illustrative examples of how science has really helped yoga to gain a foothold in the belief system of people who are walking around right now. scoliosis, rotator cuff, and osteoporosis in that order. Let's start with scoliosis. What is it? Well, what holds us up in the first place? Nothing is science that doesn't come derived from a theory. And the theory that we hold is that the spine is a tensegrity structure. What is that? It's a structure held up by tension between its parts. This toy has no part in contact with each other unless it, however, in spite of that, it has integrity. The human body has not rubber bands, but variably controlled muscles that hold its parts together. And unlike a stable structure, such as an architectural one or the squishy toy here, we can move. So another example of a tensegrity structure is the solar system, where the momentum impelled by some ancient event is countered by the invisible tether of gravity. And between the two, you have a stable structure, one pulling outward, one pulling inward, but they're in equilibrium. So here are some familiar tensegrity structures. A pole you might see in a radio antenna or a tent pole, and a Roman arch with its keystone. And if you look at our sacrum, well, our sacrum, it looks a bit like the flying buttresses of a Gothic cathedral, and it's holding in something that looks a great deal like the keystone of a Roman arch. And indeed, it is tensegrity that is holding the sacrum up. When it comes to the thoracic and lumbar and cervical spine, it's more like a radio antenna, where there are muscles pulling down ostensibly equally in each direction, holding the thing just as vertically as an area is held. Here's the neck. It actually looks like the Eiffel Tower, doesn't it? You can see the symmetrical pull of the muscles. The neck is a very busy place, and we're not going to talk about it tonight, but it's interesting to look at that. So now here's something. For hundreds, maybe thousands of years, people have thought that this bulgy side is the strong side. But what's actually happening here, just like a tower here, if the cables were pulling more powerfully down on this side, the bulgy side would be the weak side, and the strong side would be the one towards which the tower is inclined. This is a mistake that has been made by most people for generations, and it can confuse you as much as you like. But if the spine is in tensegrity structure, scoliosis can result from muscular imbalance, one side overpowering the pull of the other. Here's a woman. She has a curve that is convex down here on her right side. So she's strengthening the iliopsoas, the quadratus lumborum, the spinal muscles, the interspinal muscles, and going to reverse her curve. If it were a thoracic curve, it would be something like this. And there is usually a belt then that is held between the hand and the arch, so that these muscles up here in the thorax are working hard. And you must strengthen them so that they equal the strength of the muscles that previously were curving the spine towards the opposite direction. Here's some of our successes. I just want to show you one. Here's another one. I mean, I'm just not going to bore you with them, but just to show you a few. That's what happens. Here's our first study, which here's the curve. See, these are how many degrees the curve was. We had an older woman with a 120-degree curve that went down into the mid 80s, high 80s within a couple of months. You can see most of them go down. They don't all, a couple of them go up. Here's this dark line is the average of all of them. They went from 37 degrees to 25. Here's another study. This is 56 adolescents. Where they improved one category. The categories are the standard things they do in medicine: 10 to 25 degrees, 25 to 40, 10 to 25, that's you watch them observantly. The patient is left there helpless and hapless, hoping against hope. What are they going to do? If they stay in that range, nothing. Then they can go between 25 and 45, in which case bracing is usually indicated, at least among adolescents. And then above 45, surgery. Those are the three categories. Well, those that did the yoga pose, out of 21 patients, 18 of them improved quite a bit. Amongst those that did not do the yoga, none improved. That's in the lumbar spine. In the thoracic spine, the same sort of thing occurred. And not as many improved, but the only ones that improved were the ones that did yoga. Otherwise, yoga has a natural history of improving a lot of things. Scoliosis has a natural history of getting worse about 1 degree per year. Here's another study, 74 adolescents and adults. Here's how much they improved. Their curves were up here, and they went down here. Now, these are the these are the degenerative, the older people. Here are the younger people. Who improved the most? The younger people. Here in the thoracic spine, it's the older people that improved the most. And these are how many months this was studied for. Here's another one. Here's the thoracolumbar curve. Here's before they started. Here's a couple of months later. And here's how much they improved. Here's where they started. They didn't get better in this one. And here's how much they improved. They didn't improve. Who are these people that didn't improve? They're the controls, the ones that didn't do the yoga. All intervention, all the people for the lumbar, the thoracic, the thoracolumbar, they improved from 32 to 24. And the percent improvement was 25%. That's not too bad. Now, I'm doing a study now, and I want to tell you a little bit about it. It's yoga plus botulinum toxin. It's what you call integrative medicine. Oh, gosh, it's going the wrong way, isn't it? Let's see if I can make it go the right way. I can, I know I can. What you do is you use botulinum here on the strong side to temporarily weaken it, and you use yoga here to permanently strengthen the muscles on the opposite side. It's only for the lumbar spine, so here's the pose they do, and here are the muscles that are involved. So far, people are getting quite a bit better in just 3 weeks. And in 3 months, they continue to get better. Now, the botulinum toxin only lasts about six weeks, somewhere in here, 6 to 8 weeks. Why do they continue to get better? There are detailed answers for that we don't have time to go into right now, but I'm happy to talk to you about them later if you want to know. I'm looking for patients for this study, so I want to recommend to you that you either use this QR or call this number or text me or email me here. You can text me. You can't text here, you have to call, or you can email here. It's free, of course. It's approved by the FDA and lots of other people. Many doctors have looked at this to be sure it's safe. 10 more spaces is all we have. People 12 to 20. It's one office visit. That's all. It's in New York City. So I bring this to you. Hope that some of you can use it to your benefit. Now, the people that don't do yoga, they're in that middle group before they're ready for surgery, but after you're just observantly, watchfully waiting for them, they get braces. And there are problems with the braces. These are teenagers whose bodies are changing. They can't see them. They can't really feel them. Secondly, their appetite for affection is growing. And yet there's not much hugging, there's not much dancing, there's not even much volleyball or swimming. There are a lot of things that they're excluded from. And possibly most important of all, as they're going through that stage, their loyalties are changing. What happens at home is not as important as what happens at school. And these kids, exactly because they're, quote, different, can't participate in all the activities, are sometimes alienated and even ostracized by other children. And that's the most serious. A German study shows that the self-esteem of people in these braces plummets right from the time that they receive them. Then there's the surgery, which works. It works. However, it works a little too well because after having it, you can't turn. These girders in here prevent exactly the motion that the spine permits. Now, another advantage to the yoga is a boy is called osteogenesis imperfecta. He wants to be a doctor. He's a straight A student, but his bones are so soft. He's very severe scoliosis, but they're sort of like stale bread. A screw looks like it's going to hold. It's never going to hold. He cannot have surgery, but he has gotten quite a bit better with yoga. Now, here's my last thing about scoliosis is that there's studies of the brain. There's a new one in Singapore too, that shows that the brains of scoliotic people are different. They had normal people lift one finger. How do you like that for a dramatic activity? And here are the normal people. Here are the people with scoliosis. You can see different parts of the brain light up. But the trouble with it is, so they say, aha, scoliosis has a neural onset. And there may be truth in it. I can't tell. What I do see is that there's a chicken and egg problem. Is their brain acting differently because of the scoliosis? Or do they have the scoliosis because the brain is acting differently? For that, you need something predictive to look at a child at 6 or 7 and say, this one will have scoliosis and that one will not. So it's food for thought. There's another, the financial aspect is quite considerable too. 600,000 scoliosis visits annually and 38,000 surgeries, adding up to about $7 billion. The yoga, $75 a throw. Medicare and its infinite wisdom has decided to pay for this, but not to pay for this, which would be only a 250,000% savings. The yoga altogether, if you added it up, would be about a little less than $3 million, not $7 billion. So enough said about that. Let's talk about rotator cuff. What is it? It's a tear in the supraspinatus muscle 90% of the time. Here's an MRI of it showing these two parts are actually rent asunder. They're actually not touching each other. Well, why do you need that muscle anyway? Well, we'll get to that. But in the meantime, this one, I'm the first patient. And by standing on my head for a couple of minutes, I got up, and before I couldn't raise my arm to save my soul. And afterwards, after 3 minutes on my head, my goodness, I could raise my arms. It was fantastic. Now, what was going on, I didn't know. So I went to work, brought my yoga duds, and had a physical therapist do EMG on me while I was standing on my head, because this is the pose that did it. In the Iyengar way, we raise your shoulders up like this. And now you're raising your shoulders up, but of course, when you're standing up, that would mean you're pulling your shoulders down and together. But this is the way Mr. Iyengar teaches headstand. So here's a rather corpulent man, an accountant from Scarsdale. He did it in a chair, and all he had to do was raise his shoulder blades up like that. Brilliant physical therapist, Tova Ovadia, showed me another way to do it, which spares your eyes. I mean, in this one, if you have cervical problems, cardiovascular problems, ophthalmological problems, you can't do it. But you can do this. And this is the one we used with these people. Look at him. He went from an abduction of 70 degrees to 150. Flexion more than doubled. Adduction didn't change at all. And his pain went down by about a factor of 3. Here's an 81-year-old patent attorney. She did yoga. The others did not. Her pain was 7. It went down to 1. Her abduction went from 75 degrees. It more than doubled. Here she's in pain. Here she's tentative and very surprised. Here she's bewildered. Look, that's no 75 degrees. That's 175 degrees. Here's a dance director from Alvin Ailey. Look where she went from all the same thing, really, 65 to 175. She was, and you know how long this takes? You're not going to believe it. A minute. 1. What's happening here? Well, the deltoid raises the arm, doesn't it? Well, it can raise it up to a certain point, but then when it gets to horizontal, its fibers are pulling horizontally. So it can no more lift the arm beyond 90 degrees than you can pull on a clothesline and make it rise above horizontal. Ain't going to do it. So what happens in those degrees between 80 and about 110 is the supraspinatus comes in. And that's the muscle that, of course, is torn. So then once it gets up to 110 degrees, the deltoid can take over because there's a vertical component to its pressure, to its tension, and it raises the arm powerfully the rest of the way. But what happens when the supraspinatus can't raise the arm, as in the case I showed you where it's torn into pieces? What happens then? Well, you try and struggle, but you cannot get your arm above 90 degrees. That's what was happening to me. But when you stand on your head and pull your shoulders away from the mat, away from the floor, the subscapularis, another muscle in the rotator cuff, gets activated. And what it does is, and oh, by the way, the deltoid at the same time gets a little quieter. So it's no longer pulling, it's just sort of acting like a fulcrum. The supraspinatus pulls down, and like a cantilever, the shaft of the humerus goes up. Then when you teach people this, you have to make them abduct twice and flex twice so that this new way of using their muscles becomes inculcated. And for some people, you're going to think I'm lying. They remember it their whole lives. The muscle, the supraspinatus, never heals, and they never have problems with their shoulder again. So here, an 8-channel EMG. So when you see the squiggles, that means the muscle is active. I'll just show you one thing. The subscapularis, you can see when it gets up here to 80 degrees, look what happens. There's a spindle of activity, and the deltoid quiets down. So the deltoid is just holding the arm, and the subscapularis is pulling it down so that the deltoid can pull it up. That's all I want to show you. So now I took 50 patients, I looked at them, they got about 80% better. That's about how much better they got, a little better than 80%. I was worried this is a parlor trick. People were calling me names saying, this is some kind of trick. It can't really be right that this can happen. Surgeons wanted to get me kicked out of Columbia. Honestly, they did. They said, this man is dangerous. Indeed, I suppose I am. But this was very significant with 50 patients. The chance of this, the likelihood of this happening by chance was less than 1 in 1,000. It was significant on different ways of looking at it. If you look at this, this is a hard curve to read. Here, this is the number of patients that can do what they're supposed to do, their immediate improvement. And here are the number of degrees that they improved. So you can see the shoulder on the curve is about 125%. That's when it starts falling off. But most people get 100% better. So if they had a range of 75 degrees, it's going to be 150. I didn't know how long it was going to last. This parlor trick idea got to me. So I did a larger study. And I followed 50 people for 2.5 years, 30 months. And they improved quite considerably. Then I got excited about it, and I got a grant to look from, and the FDA approved it and all, to look at patients. And so I did the same thing, and just to sum it up, they got amazingly better at 0.0008. You know, these are highly significant numbers, showing that we probably really are onto something here. This is really a very simple thing. Here, I followed those patients up because of that same nagging feeling. Is this something that works for a while and then, gosh, it's not going to work anymore? And that is absolutely not what we found. Here we are looking at them. The pandemic actually helped us here, because we had a lot more time to think about it before we actually did the second interview and saw, well, okay, how are you doing? And found that at a minimum of 2.5 years, and a mean, the average being more than 4 years, we looked at these people, and once again, highly significant. Here's comparing it with other non-surgical means. One of these is Dutch, one of these is Turkish. And here's how much better we got them compared to these guys. Same thing for the flexion as it was for abduction. Look, we didn't look at this as pain. Look how we're dwindling down here. But this is, we don't want pain. We want the pain to be lower. And we certainly did that. Looking at the surgical comparison, the results are also very optimistic. Here's how much better they got people with respect to pain. This is Linto. This is a Dutch study. This is a German study. This is our study. We got them basically 6 times better than they were. This one got them about 4 times better than, no, maybe 3 times better than they were. And this one cut their pain in half. But that's no question about it. Percentage of pain reduction, the yoga does better than these other people. When it comes to the arthroscopy, Anderson, American study, actually did a little better than we did. But look where he started. Look at the degree of range of motion he started with. He started with about 140 degrees, and we started with 80. So again, the yoga is proving its worth. Now we've seen this many patients, the vast majority of them improve. And we have noticed one side effect. There is inconsistently greater arthritis because the muscle, the bone is moving not exactly the way the good Lord intended it. By the way, it doesn't move that way in surgery either, but I have to say our methods are, they can't match nature. Here's a man, you see the little surgical staples here? He had surgery on this side 15 years before this was taken. And here he did the yoga. Do you see more arthritis here? I'm not sure I do. I'm not at all sure that I see more arthritis on either side. So the decision is the dangers of pain, of surgery, which are considerable, the pain, and I'm not even going to mention the sequelae, 3 months of pain usually, but always 3 months of disability, of 6 weeks of passive range of motion, 6 of active assisted, and so on. And of course, the financial cost. Here you have only the pleasure of yoga. And a minute later, yes, you have to pay the yoga therapist, and that's it. So now let's talk about osteoporosis. These are all the people that have helped me. I've left somebody out here, a woman named Terry Schaff. She's supposed to fit in here. But anyway, this has been a long work, many, many years studying this. I'll give you the Twitter version of what it is. It's a disease with bones become fragile and they progress painlessly. It's called the silent disease. And then you get fractures of the spine, hip, and wrist when the disease makes itself known. But if you don't know where you're going, how can you tell when you get there? What are we trying to do in this condition? Well, we're trying to strengthen the bones. And I want to tell you, the medicines do it. Here's the alternative to what we're saying. Here's the placebo, and here's the medicine. See, it takes off like a rocket. But I want you to notice something. These are months down here. After 36 months, 3 years, it's not taking off like a rocket anymore. It's humping over, and it's hardly making much progress at all. From 2 years to 3 years, it's not getting much bigger, just this much. Look at from 0 to 1 year, it went all the way up to here. But now it's leveling off. And this is the spine. When it comes to the hip, my goodness, it is leveling off. So I want you to bear that in mind. It's not the only thing wrong with it, but it is something that often unconsidered. But I will say that it does raise the bone mineral density, as you can see. And the bone mineral density is correlated with fracture risk. In fact, the difference with someone who has a -4 in their bone mineral density versus +1 at age 60, this person has 186 times greater chance of having a fracture than this person. So if the medicine reduces the likelihood of fracture, that's a good thing. These are the women, these are the men. It's basically the same idea. But the medicines have problems. There's osteonecrosis. There are all of these things, retarded healing. You have to stand up for an hour if you don't want to hurt your stomach really a lot. Atrial fibrillation is arising. There's, for the injection forms, there's sclerotic eye problems. So here's what we're talking about. What the medicines do is they inhibit the osteoclasts, the cells that take bone and dissolve it back and return its elements into the systemic circulation. The osteoblasts and osteocytes, they're making the bone. The medicines, for the most part, don't touch them. There's some new ones that do, but we'll get to them. I'm not sure. But the point is that what the medicines we're talking about, the bisphosphonates, still the most popular medicines, they depress the osteoclasts. So it's not an equal match. There are 2 big guys. Here's 1 little guy. It's not fair. You cannot ignore the anatomy and physiology, which I'm about to show you. You see, if you take a cross-section of a bone cell, it doesn't have a lot of blood vessels. It can't because it would be too soft. It wouldn't be strong enough to support you in the manner to which you become accustomed. So the vein and the artery and the nerve are right here in the middle of the Haversian canal. And then you want to ask, well, then how does this cell get any blood? How does it get the oxygen, the glucose, the protein, the hormones, all the things it needs? Answer, these cells look like Portuguese men of war, and indeed they are. Their tentacles take up enough oxygen here, so this cell takes some for itself and gives some to this cell. This cell takes some for itself, gives some to this cell, and so on, all the way up this Congo line, which can be 11 cells long. But now, what happens if one of these cells gets sick, damaged, or injured, or dies? What about these cells? What's going to happen to these cells out here? They're not going to get the glucose and oxygen and so on, and they're not going to be able to dispose of the products, the toxic products of metabolism, which the tentacles conduct the other way, back down to the vein, and out they go. I don't know how many of you have seen that movie, The Avatar, but these cells connect to each other just like the tails of those creatures in the Avatar. And what happens when those tails are unconnected is the cells out here, they die. They don't get what they need. Pretty soon, whole sheets of cells die. because more and more of them can't get what they need or get rid of what they need to get rid of. As a consequence of which there is now a class action suit against the companies because they get spontaneous fractures. They didn't do anything wrong. They just fracture the bone because enough of these cells die to make the bone frangible and without any integrity. So these are why the bisphosphonates cause osteonecrosis, death of the bone, and spontaneous fractures. So what's so good about yoga? So all right, so that's what's wrong with the medicines. What's so good about yoga? Well, to understand that, you have to understand Wolff's law. The architectonic, which means the substructure, the infrastructure of a bone, follows the lines of force to which the bone is exposed. And this is what happens. There's a deforming force on the cell membrane, which generates an electron volt, which powers a reaction, chemical reaction inside the cell. And the new molecule form wafts its way to the nucleus, enters the nucleus, makes new DNA form. The DNA goes to the RNA, goes to the ribosomes, creates spicules of osteon, which attract phosphate and calcium and make real bone. Here's the cascade. It's been shown in many ways since its inception in the 19th century. Every step of this way has been shown to make bone. You start with a physical stress, you transduce it into something that makes for a new molecule, goes into the nucleus, and makes bone. Important here is that at birth, we have like fat little arrows. Our femurs are straight. But because of Wolff's law and the pressures put on the inside of the bone in walking, by the time we're 5, we have that characteristic crook in our hip. Now, the unfortunate children that are born that never learn to walk, when they're 5, their bone still looks like this, just the way it did when they were born. So this is not some innate characteristic that makes the bone turn. It's the bone is made to respond to the pressures that it's put on. No pressure, no response. So what's good about yoga? Well, here's a lot of pressure. You can see a maximum disadvantage the femur is at with this long stretch in this right angle here. There's torque because in this pose in Warrior 2, you turn your knee outward, put torque at the acetabulum and the head and neck of the femur. And there's twisting in the vertebrae, which has value in raising the bone mineral density of the vertebral body, where the spinal fractures always occur. Now, your muscles are stronger than gravity. I'm going to stop this for a second and show you. I think it's time for me to prove to you that muscles are stronger than gravity. Are you ready? Are you set? The proof that muscles are stronger than gravity? Here we go. I couldn't resist. So now let's go back to the screen. Of course, our muscles are stronger than gravity. That's the whole point of having a muscle here on Earth, isn't it? But there is nothing that dooms a good idea to lack of acceptance faster than the overambitious claims by its protagonists. You know, you make a big statement, so now can I show that it's true? Well, here's one case. This is Eric. He was a bodybuilder and a computer guy. He lost both of his testicles to surgical intervention when he had cancer, and he survived the cancer, he survived the surgery, but then he got osteoporosis. They gave him one of these terrible medicines. It didn't work. So at this point, his doctors rubbed their chins and said, you know, Eric, you should stop doing any exercise, whatever, and you should just walk on eggshells from this point forth. Eric got so mad, he quit the doctors, he quit the medicine, and he started doing yoga. And you can see over the next 7 years, he went from osteoporosis through osteopenia and up into the gray normal range. Yeah, what do you think he does now? He's a yoga teacher. So here we did a study. I told my friends that I wanted to use yoga to counter osteoporosis. They said, Lauren, you're crazy. So I did a pilot. You're going to break their bones. So I did a study, and here's the results. 2 years of the study. I got a DEXA scan on everyone when we started. The control group did nothing. These people did yoga. They gained more than half a point and almost a full point here, while the controls, as you would expect, lost a little bit of bone in that 2-year period. Here's our big study, Lou and Rosner and Chang and me. We here's the hip. No, here's the spine. Here's the hip, which was not statistically significant. See, these are the 95% confidence intervals. For the spine, they're highly significant. For the femur, same thing. You know, a lot of zeros after the decimal point. But for the hip, they weren't, because there are different ways of measuring the hip, which we didn't know. However you look at it, the hips, even the hip improved, although our methods of measuring were not adequate. Now, if you look at these medicines, you can usually only take them for 4 or 5 years. Yoga, that's the dotted line here, doesn't start off as fast as the medicines do. After 2 years, the medicines are ahead. After 3 years, the medicines are not ahead. Yoga is well ahead for the hip and is ahead for the spine too. These lines are dotted because I don't have enough patience to make this claim with the kind of confidence I want. I can make the claim. Now, age also raises your fracture risk. See, this is 25, 45, 65. See how the curves dive down even at the same amount of loss of bone, same negative or positive levels for their DEXA scan? Age is a factor. Now, why is age a factor? Because falling is the main way that you fracture a bone. The other way that you fracture a bone in the spine is crummy posture, stooping over. So if you compare yoga with, this is again the bisphosphonates, this list goes down, down, down. This is not the end of it. This is just the beginning of it. That's what the medicines do. For yoga, it improves your posture, your balance, your range of motion, your strength. The balance, of course, is pretty important for falling. Strength, your coordination, lowers your anxiety. Now, some say, yeah, but there are medicines that'll lower your anxiety. I agree, but they impair your balance. So looking at it, it's about 6,000 per, if you look at all of them, scoliosis, rotator cuff, and osteoporosis, the sum is about $90 billion. The yoga, if you add it up, in a, rather conservative way for everybody, it's about $1 million, $1.5 million. So it's about a 6,000%, a little better than 6,000% savings, and less human misery and less factories belching forth their smoke in California and New Jersey. Now I'm going to change the subject. I'm done. I want to talk about something else because it's on my mind. It's serious. And I think I'm talking to a group of like-minded individuals. The world needs peace, guys. To me, this is E.O. Wilson, the entomologist at Harvard, said, man, what is humankind? Well, we have Paleolithic emotions, medieval institutions, and godlike technology. If you look at it, just objectively, never mind Darfur, Palestine, Ukraine, never mind, and probably several other conflicts that don't make the news, at least several. If you look at it, nothing we might fight for has the value of what we risk. What do we risk? We risk the Earth becoming a third red planet between Mars and Venus. Here we are in a delicate balance. The benefit-risk ratio is really 0 because while there is some benefit, the risk is infinite. It's everything. With the technology we have today and the communications, transportation of weapons and of killing, in previous centuries, a nation had to arm to defend itself against an existential risk, its neighbor. Now, given the weapons we have and the existential risk we face, we must disarm. I think we adults, Bob Dylan has a line in one of his songs that goes, guns and sharp swords in the hands of small children. We adults have to take their weapons away for their own good as well as ours.